Physical therapists are trained to be practitioners of choice when it comes to providing health promotion therapies to all children in order to promote fitness, wellness, and prevent illness, diseases, or impairment. Pediatrics seek physical therapists for a variety of reasons, including bone and muscle problems, sports related injuries, and genetic, brain, spinal, and nerve diseases. Pediatric physical therapist works with children under the age of 18 from newborns to teenagers. Pediatric physical therapists help them to improve their range of motion, strength, flexibility, balance, coordination, and movement patterns. Experts in patient management for children with functional restricted mobility and or movement disorders who employ family-centered care strategies while being aware of and paying attention to the impact of the child's, family, and community environment on health outcomes. They also aid young athletes in avoiding injury by correcting any muscular imbalances or weaknesses, as well as assisting them in returning to play following an injury. Due to the fact that children are likely to develop while undergoing rehabilitation, it is vital that they stick to their physical therapy program as closely as possible. It is much more important to respond to any complaints as soon as possible as they rise. Our aim is to assist children learn to successfully and independently perform gross motor skills and functional mobility abilities, developmental activities, therapeutic exercises, balance and coordination exercises, adaptive play activities, mobility training, safety and preventive programs, and activities to improve general well-being are some of the therapeutic interventions used. Pediatric physical therapy can change a child's future.
Noah was diagnosed with spastic diplegia cerebral palsy at 11 months old. At 13 months old, Noah was not sleeping and seemed uncomfortable most of the time, and was not sitting up, not rolling over, spent a good portion of her day laying on her back looking at the ceiling unless she was being held, which was most of the time. Since we've started physical therapy at Glacial Ridge, she's taken huge strides, mostly in fear. She was very fearful before we started, and that can stunt progress tremendously. And Amanda and Keisha have worked with her every week on being braver and having more fun. And she's gone from taking a step to taking 7 steps. She's gained tremendous trunk control, way more than she had before we started. Crawling is reciprocal now, one knee, other knee, not bunny hopping. The relationship between Noah and her therapists is that they're friends. She loves them and wants them to come to her birthday party, and she looks forward to seeing them every time we come. She has never once said that she didn't want to come. She's looked forward to every visit, and yeah, she loves them. I love her therapists. They have helped me in ways that I've never had help before. They've made phone calls that I've always made on my own before. I feel safe with them. I trust them with her. I know that she's safe with them. I can sit back and relax and watch her get stronger because they're good at what they do, and yeah, I adore them. The goals that we have moving forward are independence and her best adult life, so that she can do anything and everything that she wants to. And if we put in the hard work now, which I really feel Amanda and Keisha are doing, then it will change the course of her future. I would tell other parents to not take no for an answer and to not settle because they think that's all that's available. I would want them to know that this is here and that it is available, and it's not that hard to get to. It's actually a really enjoyable experience, and that they're doing the right thing by offering their kids a better future.
Before the therapy, Danica was not really communication much, and then after therapy, she's getting much better. She can use the pictures to communication a lot right now. If she wants some sugar or candies, she always handing the pictures for me. And Danica is really comfortable over here. And then for me to understand, she comfortable over here and make her a lot easier. I just feel really comfortable over here.